Hello everyone. Our group members are Cameron Killings, Oriana Knights, Ali Sosa, Abigail Patterson, and myself, Stephanie Reynoso, and we will be talking about Parkinson's disease. Hello, I'm Stephanie Reynoso, and I'll be introducing Parkinson's disease. What is Parkinson's disease? This is a progressive neurological disorder that affects movement. It occurs when nerve cells in the brain, specifically in the substantia nigra, stop producing enough dopamine, a chemical that helps control muscle movements. This leads to symptoms such as tremors, muscle stiffness, slow movements, and balance problems. But my classmate Cameron Killings will be talking more about the signs and symptoms of Parkinson's disease. In other words, Parkinson's disease is like your brain's control center for movement, slowly running out of fuel. It happens because these special brain cells, the dopamines that we already talked about, start dying off. While there's no cure, treatment like medication, physical therapy, and in some cases surgery can help manage the symptoms. Hello, it's me again, Stephanie Reynoso, and now I'm going to be talking about causes and modifiable risk factors for Parkinson's disease. Some causes can be loss of dopamine, genetic mutations, environmental triggers, and the presence of Lewy bodies, which are clumps of the alpha synuclein proteins, which pretty much regulate the neurotransmitters in the brain. For environmental risk factors, we have exposure to pesticides, herbicides, solvents, metals, and other pollutants. Lifestyle can play a role, like smoking, heavy alcohol consumption, and lack of exercise. Some medications, such as NSAIDs, calcium channel blockers, statins, head trauma, repeated blows to the head may increase the risk, and genetics, as we said, um, and pretty much family history of Parkinson's disease. What can we do to reduce these risk factors? Exercise can be one of them. Aerobic exercise, such as cycling, running, team sports, maybe lower the risk. Caffeine, drinking caffeinated beverages such as coffee and green tea may lower the risk of Parkinson's disease. Uric acid, the antioxidative effect of uric acid may lower the risk of Parkinson's disease. Certain medicines can lead to Parkinsonism, which have similar symptoms to Parkinson's disease, and low levels of vitamin D may be a risk factors for Parkinson's disease. And that completes my slide. Now I'm going to pass it to my classmate Cameron Killings, and she'll be talking about signs and symptoms of Parkinson's disease. Thank you.
Cameron Killings, and I'm going to be talking about some symptoms of Parkinson's disease. So these patients are going to experience tremors, rigidity, bradykinesia, which is like overall slow movement, drooling, dysphagia, so difficulty with eating, swallowing, akinesia, which is poor voluntary movement, postural hypotension, so we're telling these people to change position slowly, a shuffling walk, decreased arm swinging, micrographia, which is small handwriting. They may have like a mask like expressionless face. They can experience dystonia, which is involuntary repetitive movements, and they may experience some psychiatric changes. And then these patients can also have problems with their balance and experience muscle stiffness. Cameron Killings, and I'm going to be talking about management and treatment for Parkinson's. So we have levodopa, which is like the first line treatment for Parkinson's disease, and it helps controls tremors and their unsteady gait. And we have carbidopa, which helps avoid metabolism of the levodopa before it can reach the brain. So those two are used kind of in conjunction. And then we have bromocriptine, and that aids with the bradykinesia, which is like the slow movement. We have MAOIs that stop the breakdown of dopamine. And then we want to perform some safety measures. So we're going to provide assistive devices, tell them to wear non-skid socks and shoes. And then we want to give these patients enough time to get things done because we know that they're going to be moving at a slower pace. And then overall, we want to preserve their ADLs and their ability to do things independently. We want to encourage them to do exercise, tell them to relax before meals and provide thick liquids and ensure the patient is sitting up when they're getting meals and food. And then make sure that the food is kind of semi-solid because we did mention that they have some issues with swallowing, that dysphagia symptom.
Hi, my name is Oriana Knight, and I'll be covering creation life principles as it applies to Parkinson's disease. The first letter is C for choice, and it is important to make healthy choices to boost energy, mood, and physical function. A tip is to eat a balanced diet with antioxidants, healthy fats, and fibers. The next letter is R for rest, and it's also important to prioritize rest to reduce stress and improve motor function. A tip for that is to aim for 7 to 9 hours of sleep each night. The next letter is E for environment. Creating a safe and supportive environment will help to reduce fall risk. So, using grab bars and assistive devices like walkers will help in making that space safe. The next letter is A for activity. Exercise maintains strength, mobility, and cognitive function. So, exercise 30 minutes most days, such as walking or doing yoga. The next letter is T for trust. Trust in God, yourself, and your healthcare team. A tip is to keep a journal to track symptoms and medications. The next letter is I for interpersonal relationships. Stay socially connected for emotional support. So join support groups or engage with loved ones regularly. The next letter is O for outlook. A positive outlook helps manage symptoms. So practice mindfulness and gratitude. The last letter is N for nutrition. Proper nutrition supports brain health and energy. So eat fruits, vegetables, omega 3s, and fiber foods. Thank you.
Hi, my name is Abigail Patterson, and I will be covering this slide on preventative measures. I will be discussing today primary, secondary, and tertiary preventions. For the first one, which is primary, we are going to try to reduce the risk. While there are no guarantees to prevent Parkinson's disease, there are some lifestyle factors that can reduce the risk or help slow the progression, such as healthy lifestyle, regular physical activity, balanced diet, avoiding chemicals and environmental toxins. For secondary prevention, this is going to be identifying our early symptoms. This could be tremor, slow movements, muscle stiffness, sleep problems. This is the section that we're going to hope to stop or delay the onset of Parkinson's. Lastly is tertiary. This is to slow the progression. With the help of healthcare providers, they can prescribe medications and rehabilitation to help manage this disease. This also relates to Newman's model, because the goal of this theory is to help each patient interact with their environment. These preventative measures helps clients to live a more complex life with Parkinson's disease. Thank you.
Hello, my name is Allie, and I'll be talking about some support and resources that are available for patients with Parkinson's disease. There are many resources that are available for those patients that are diagnosed with Parkinson's. The first one I want to talk about is the American Parkinson's Association. They have a very detailed website with many different resources, including a symptom manager tracking app, booklets and fact sheets about the disease and how to live with Parkinson's, including diet and exercise, and also support groups that are available. The second foundation is the Parkinson's Foundation, and I have the number listed there as well. They have a list of events that you can attend, different support groups, and they offer resources for caregivers as well. In the state of Florida, there are organizations as well that could aid in supporting these patients with Parkinson's. The Parkinson's Association of Central Florida has many resources on their website as well, events to attend, and fundraising for research available. Parkinson's is a disease that requires collaborative care, and it seems like there are quite a few organizations that offer support for these patients.